Financial Survival Network, helping you to survive and thrive in the new economy. Get our complimentary newsletter at financialsurvivalnetwork.com. This is the Financial Survival Network.
These are tough times, and they're getting even tougher. The clock is ticking. The countdown to collapse is well underway. What are you going to do about it? Will you just wait for it to happen, or will you be ready when it happens? The decision is yours, and yours alone. Join myself, Mickey Fulp, Robert Ian, David Morgan, Jeff Berwick, Elijah Johnson, Alan Butler, Gregory Manarino, Daniel Amaduri, Andy Hoffman, Tekoa Da Silva, Trace Mayer, one of the world's leading Bitcoin authorities, Bix Weir, Jay Taylor, and Gary Christensen at the Liberty Mastermind Symposium in Las Vegas on February 21st and 22nd, and learn how to create your plan to survive the collapse. The last Liberty Mastermind Symposium was one of the most highly rated conferences ever, and this one promises to be even better. Don't miss it. Join us and register now at libertymastermind.us. libertymastermind.us. This one is going to be out of this world, and it's going to be even better because it's in Las Vegas, Nevada. Go to Liberty Mastermind US and sign up today. You are listening to the FinancialSurvivalNetwork.com. I'm Kerry Lutz on 1230 WBZT. Well, Obamacare, you're seeing the chaos, and it's not even January 1st, 2014. You need to understand how it's going to impact you, your family, your company, the economy at large, the country. That's why we've got Jim Skinner back from smartpatientacademy.com. Jim, welcome back.
Thanks, Kerry. Pleasure to be back.
Hey, so it hasn't even hit the fan yet because we don't even know the impact of Obamacare compliant policies on the small group market, on the small business group market. But you've got a sneak peek for us, don't you?
Yeah, I do. I'm sitting here in the state of Texas, and part of what we do is we can function as a insurance broker in the state of Texas for groups. And here's just an example of what I'm looking at. I'm looking at United Healthcare in the San Antonio region for an 18-man company. I'm comparing exactly the same United Healthcare policy in 2013 to 2014, 2014 being an Obamacare compliant plan. And the difference for the employee only, here's the employee only cost in 2013. It's $295.90 for an individual for 1 month. And you go 3 days later into the 1st of January 2014, and the same policy is $461. So it goes from $295 to $461. Same plan. So we're seeing, as you're saying, a lot of the world hasn't yet seen the Obamacare compliant plans. They haven't yet seen all of the rate shock. But, you know, we're kind of on the cutting edge of it. Some people have seen it, but there's a lot more to come in terms of rate shock, plan design shock, what we call out-of-pocket shock, too. So there's also another thing called network shock. So if you want to delve into those two pieces, the price shock everybody's got. They understand what that is. The out-of-pocket shock is where the government basically came in and mandated to the insurance companies what the maximum out-of-pocket will be for all plans.
Yeah, that was $63.50, but they put that off for a year. So it's not going to apply the first year, if I'm not mistaken.
Yeah, but think of it this way. This is like going in and telling Toyota, who's manufacturing a Toyota truck, and they've got their production line going to build a truck. And then the government comes in and says, you can't manufacture the truck anymore. You've got to manufacture a Lexus. So the company reconfigures everything they're doing. Their entire product line changes to accommodate the Lexus. Well, then 3 weeks to a month before the deadline, the government comes back and says, hey, you know what? You guys can actually do the Toyota truck again.
But it's too late. It's too late.
But the carriers have already, they've reconfigured everything and spent millions and millions of dollars doing it. Do you think they want to go backwards?
They can't. They can't, because it's already retooled, and you can't just roll back your systems and say, hey, all right, we'll go back to the Toyota.
Right. We'll go back to the truck. Yeah. So we've got some companies that said, yeah, we can do that for a period of time. You've got other companies that just said, no, we're not doing that. And basically the insurance carriers are kind of scratching their heads going, wow, how do we manage this environment when the government is making up this stuff as they go? They change rules about every week on some issue. So most of the carriers, for stability's sake, and just because of their investments, even though they're not, put it this way, that out-of-pocket requirement that you're talking about may not be available through the carrier, even though the government has allowed it to exist. In other words, to be variations. So the government can tell them what to do, but they can't go back and recreate everything all of a sudden from one week to the next. So that's what we're seeing. And then we're also seeing this thing that we're calling network shock, where on the exchanges, these are the government exchanges, not the private exchanges, but a lot of the carriers, in order to get the prices down and to keep competitive, they've taken their regular networks and they've pared them down. So you might have a United Healthcare network in your state or an Aetna network that is 75% of the size of the network you're used to. But because there's all sorts of flaws in the, on the Obamacare websites, you can't actually go out and see all your providers in all these different states. So some you can, some you can't. It's a hodgepodge of problems. But there is a trend, is what I'm saying, is there's a trend towards what they're calling narrower networks. Fancy way of saying we're limiting the choice of doctors, we're limiting the choice of hospitals in the same town, but it is say, an Aetna network. So you got to be very careful, is my point. When somebody's talking about a network, you got to find out, well, which one?
But I thought I could keep my doctor. I could keep my insurance policy if I liked it. Guess that wasn't true, huh?
I guess not. I'm just not sure how the guy got away with that, but somebody's got to hold his feet to the fire. So we do have that component. You've got the rate shock still happening, and in the individual market, that rate shock has occurred. And by the way, in terms of the mandates, the large groups got a reprieve on, mandated coverage. They have to provide coverage if you're a group over 50. Small groups don't have to do that. But there was still a requirement that everybody in 2014 have health insurance or pay a fine. So that hasn't gone away. Individuals are out there looking and trying to figure out, well, what's relevant to me? How do I navigate through this system? And so I think that's one of the reasons that we created the company we did, the Smart Patient Academy, and creating this content around showing people, regardless of what happens to Obamacare and regardless of all the politics, you and I as consumers have to be able to function on a predictable platform going forward. And so what is that? And that's really what we talk about, is how to navigate through a system that's in total turmoil. It really, requires you and I to be really change our mindset.
Yeah, this is insane. Hey, I heard one other thing that I found pretty disturbing, and that is that if you're away traveling and you get sick or you need surgery, somehow out of network isn't going to be covered under your health insurance. Is that correct?
Well, Probably not. Here's what the rules are, and these rules have they're in place currently, and they will be in place in 2014. So this is the way to think about it and get it clear in your mind, is that when you have a life-threatening emergency anywhere in the world, it is going to be covered as if you were in your home state, in your home zip code, at your home hospital. But underline, listen to the words I just said, a life-threatening emergency, a life or limb-threatening emergency. That's a legitimate concern that you may die or you may lose your limb. If you have a bad flu or you're in Mexico and you've got Montezuma's Revenge or something like that, that's not a life-threatening emergency, so you're now out of network on any circumstance. And when I was talking about narrow networks, when I refer to narrow networks, it also means that a lot of these plans have no out-of-network benefit, only in-network benefits, unless it's a life-threatening emergency. So that may be what you're referring to.
Right. Yeah, that was my understanding, that you're not going to have any out-of-network benefits on most of these policies. Yeah,
they're called EPO plans, and that's what I was that's what I was getting to when I was saying network shock. You've got to look and see whether or not there's an out-of-network benefit. And a lot of people just say, I've got an Aetna, Cigna, Humana, United Healthcare plan, and, I'm familiar with that network. Well, if you're getting it through the exchange, it's probably not the same network you're used to. And it's possible it may not have any out-of-network benefit coverage at all.
Wow.
So you've got to be really careful about that.
Big change there.
Yeah, absolutely. So go in with your eyes wide open into whatever you're looking at. Absolutely.
Yeah, you have to be aware of that, because so basically it's going to be like you can get health care covered by your plan in your county where you live, and unless it's life-threatening, you could pretty much forget about it.
Yeah, on the plans that have no out-of-network benefit, they're the narrow networks, which is really the trend in healthcare. So that trend, if you extrapolate that trend out a few years going forward, you're going to see this happening more and more. You're going to see more and more doctors opting out of large networks. This is my opinion and the opinion of a lot of experts. And what doctors are going to start doing is they're just going to start posting prices. Like you go into a restaurant and they say, here you're going into an ENT, and you're going to pay $750 for an endoscopy, or just for a visit you'll pay $82, and if you want to file the claim, you can. But we're not doing your insurance for you anymore. And it's more of a direct business relationship between the consumer and the doctor, because they just can't be micromanaged like that. I think they're really hit a wall.
Really?
So I guess my overall theme here would be for your listeners is that independent of what's happening with Obamacare and the politics of all of this, which we both dislike immensely, there is if it completely goes away and it's repealed, we're not going to go back to the way things were 3-4 years ago. There's aspects of this law that have permanently changed the delivery of care, and it's having an impact on corporate benefits. It's having an impact on provider communities. It's having an impact on the insurance industry. It's having an impact on individuals. And the way healthcare is actually distributed, bought, and sold is changing too. All of these factors are permanent changes.
Yeah, nothing's going to change it.
No, we're not going back. The genie's not going back into the bottle. And partly partly this is due to the fact that you have to turn the clock back to pre-Obamacare days. And if you just looked at sheer demographics, you're looking at the baby boom population is about 78 million people, baby boomers, about 10,000 of which are hitting per day, are hitting and qualifying for Medicare. It's Medicare is government priced, underpriced, micromanaged a pricing mechanism. In other words, the commercial market, the market that you and I are in under 65, is subsidizing the over 65 market. And it was set up in 1964 that way. So it's something of a little bit like Social Security, in that you've got all the workers supporting the people that are retired. But when you get into a big demographic bulge, it doesn't work anymore. You have too many people retired for the number of people working. We've got a similar situation with Medicare. You've got too many people entering into Medicare, then there is money to cover it.
Right. That makes sense.
So the marketplace is fundamentally broken before Obamacare was instituted.
And it's the government's fault. Totally the government's fault.
It's the government micromanaging the market. 19% of our GDP is tied up in healthcare related services and products. And the government, it's never been a natural market since 1964.
So the free market didn't fail.
Correct. The free market did not fail. It's been micromanaged, and it's been disguised, and it's been sold, and it's the jig is up. We can't sustain it. So that's why I'm telling you that, and everybody needs to understand this, so that they realize, look, there's fundamental changes that were going to occur. Government just got in and made it 10 times worse again. And I, as a consumer, need to take control of this environment myself.
Accept it.
And that's kind of...
Accept it.
Go ahead.
Accept the fact that the jig is up, because it's actuarially unsound. And if you don't understand what an actuary is, he's the guy that figures out the odds for the insurance casino and explains to them how to make money at all, basically at every table in the insurance house, whether it's the health insurance table, the auto insurance table, the life insurance table, the property and casualty table. He tells them how to make the money regardless what happens. And there's no way to make money at this table because Uncle Sam has got the tables rigged. And unfortunately, he rigged them improperly here basically 50 years ago. Right, Jim?
You got it. That's a great analogy. They really did that. They rigged the tables incorrectly, and it was good enough to last for 3 to 4 decades, and then it started to come unraveled, and now we're seeing the fruition of it. And so, yeah, the market will go where it's going to go, independent of government. And so, that's why we're seeing prices go through the roofs. That's why we're seeing doctors opt out of what's going on. That's why we're seeing the employee relationship change, where they're shifting responsibility and risk and cost from employer to employee. Very much that same transition occurred when we went from defined benefit retirement plans to defined contribution plans. We're kind of in that arena now. So it's a classic case of, American ingenuity is going to have to come through the woodwork here. And here's where the good news is. I don't want to sound like I'm wringing my hands too much, but here's the good news, is that over the longer term, and I want to say longer term is, 12 to 15 months, maybe 18 months, somewhere out there, we're going to start seeing a backlash against government as a solution in the marketplace of healthcare and move more in the direction of the market. And the reason is that there isn't any other solution. There's either the market is a solution or the government is a solution. Those are the two opposite ends of the spectrum. And so now the guy out in the field, we'll call him Alex Average, is out there asking the question, well, if government doesn't work, then what actually does work? And the answer is pretty obvious. The market will work. You just got to allow it to work, A, and B, someone has to show you how to make it work for you.
Yep, and that is what it's all about, and that's what we stand for on the Financial Survival Network, market-based solutions, allowing the market to work its magic. Market-based solutions mean efficiency and the greatest good for the greatest number of people. And those are the precepts the country was founded upon. And you just have to look. When you go to Starbucks in the morning or Dunkin' Donuts, the government didn't put that cup of coffee on the counter. The market did. If you relied upon the government to get that coffee there, it would be watered down. It would be garbage. And you wouldn't be there. Basically, it would be a Soviet-style collective experience, and nobody would be there. The place would be empty. The fact that people are lined up, given their $5 for that cup of coffee, is a triumph of market experience. And that's what will happen, Jim, in my opinion, once the market's allowed to function. The efficient producers will be the ones that make out like bandits here, and the inefficient producers will fall by the wayside, and the ones that embraced Obamacare will all see, their bottom line impacted, and they will be gone.
Yeah, absolutely. Absolutely. The manifestation of that, I think you and I have talked before, but one of the coolest manifestations of that is the requirement of providers of all types, like hospitals in particular, have now got to disclose their prices out there where they didn't. This is one little bit, maybe 2 pages out of 2,200 pages out of this law that were actually pretty good, that now there's a disclosure of prices and we're finding that medical procedures in the same network by the same doctor of the same quality with the same insurance company have 300 to 500% pricing differentials. And when consumers are aware of that, what are they going to do? They're going to go to the best value provider, highest benefit for the lowest price. And that's how that market will work, and that's actually how that's actually how change will occur in healthcare. People are talking about how do you get higher quality at lower cost. I just explained how it works, and there's businesses that do nothing but that, concierge-level services that do this. And we use a company, I have no affiliation with these guys, but we use a company I like a lot called Compass out of Dallas, Texas. Southwest Airlines uses them, the Container Store uses them, and you'll have employees of the Container Store, and they'll get a request for or a prescription for an MRI. They'll call up Compass and they'll go, you've got my health plan on file. Please shop for me the best opportunity, the best option I've got for this specific MRI. And 48 hours later, you've got a report with 3 or 4 vendors, the qualitative index on each of them, and you'll see 300, 500% pricing differentials in the same zip code.
Great.
And they said, you guys, now you handle it. You're the consumer. You do what you want to do. Mm-hmm. That will have the biggest impact on healthcare, and that's going on right now. So American ingenuity is eking its way through all of this government, oppressive government, approach. So you're seeing it out there.
In spite of it. In spite of it. Now, if they could just get them to put the calorie counts in all of the hospital cafeterias, I think we'd be someplace here, Jim.
Yeah.
So we find you at smartpatientacademy.com. And of course, we'll have a link at the financialsurvivalnetwork.com show notes to this interview. So check them out. Don't forget Liberty Mastermind Symposium, libertymastermind.us. Want to have you there at the Embassy Suites in Las Vegas, February 21st, 22nd. Don't want to miss it. It's going to be a great event, just like the last one was. Jim, can't thank you for coming on and helping to clear this mess up. And I think you hit the nail on the head. Actuarially, what worked in 1964 cannot possibly work in 2014. Things change in 50 years, especially in the United States, where things are always in flux. And what worked, on a table in 1964 isn't working now. We'll talk with you again soon, Jim, and we'll keep watching the carnage because it's going to rack up really fast, and they're going to have to do something.
Thanks for the invite, Kerry. Have a great holiday in the meantime, and look forward to catching you guys in 2014.
Hey, you too. Merry Christmas, Happy New Year. We'll talk with you again soon.
All right, Kerry.
Hi, it's Kerry Lutz. I recently decided to move my retirement account into physical precious metals to hedge against the coming times. If you want to move an existing retirement account into physical precious metals that you can hold in your hand, tax-free, there's no company that can do it more quickly and efficiently than Regal Assets. It took them just 24 hours to open my new IRA account, and all I had to do was fill out one simple form. The best part is that Regal Assets does all the work for you. They cover the setup and administrative costs for 2013. If you're interested in making the same move I did, call 855-678-6620, 855-678-6620. That's 855-678-6620, or visit them at regalassets.com. You'll be glad you did, and tell them Kerry sent you. Our friend Tom Dyson at the Palm Beach Letter is giving away free copies of a really cool report he put together called How to Protect Yourself from America's New Secret Police. Inside, you'll learn all sorts of simple, everyday tricks you can use to make yourself a little less visible and vulnerable to scammers, hackers, and even the federal government. For instance, inside Tom's report, you'll learn which free internet email service never to use. This company doesn't care if your account gets hacked or not. 4 things the government must tell you if they request your social security number. And how to spot skimmers lying in wait on ATMs and gas pumps, and much, much more. These tricks and secrets are low-hanging fruit ideas. You don't have to invest time or much money into them. Most are free. But by taking some basic measures, you can make your privacy much harder to invade than your neighbors. Tom's report is available for a limited time to listeners who take a trial subscription to his newsletter. Just visit the Financial Survival Network homepage for more information, or go to www.palmbeachletter2.com. That's www.palmbeachletter2.com.
The Financial Survival Network, helping you to survive and thrive in the new economy. Get our complimentary newsletter at financialsurvivalnetwork.com. This is the Financial Survival Network.